Hello, my name is Michael Schmidt, and I'm a board-certified hypnotist, and I'm located in the Spring area, or more specifically, Woodlands, Texas. I can be contacted at 281-787-8999.
And I'm Michael Schuman. I'm a board-certified hypnotist. I office in Southwest Houston, just inside the Loop in Bel Air. My contact number is 713-662-8511.
And today we thought we would talk a little bit about some of the areas of hypnotism that we work with, some of the clients actually that we work with, and also some of the modalities that we utilize. Like who can be hypnotized was something I think you want to talk about, Michael?
Well, I think there are questions oftentimes in people's mind. Some people think that I can't be hypnotized, or I've been to a group hypnosis session and they couldn't hypnotize me, and so I probably can't be hypnotized. So one of the things I'd like to get rid of is the myth that somebody can't be hypnotized. Yes, there actually are some folks who can't be hypnotized. Those diagnosed, and I'm going to use a word of art here, not a disparaging term, those diagnosed by a psychiatrist or clinical psychologist as a psychological idiot, meaning their IQ is so low they cannot understand or respond to suggestions, those folks probably cannot be hypnotized. People who have been diagnosed as either schizophrenic or bipolar who are not on their meds generally cannot be hypnotized. On their meds, they certainly can be. Even sometimes off their meds, some of them can be hypnotized as well.
How about the elderly, Michael?
Elderly people can certainly be hypnotized. I know that you've worked with elderly clients, so have I. I just saw a lady last week who's 80 years old, went into hypnosis very easily, very comfortably. The idea is that hypnosis is a therapy of consent. You must want to do it, agree to do it, and agree to follow the instructions. And if you're of at least normal intelligence, you'll be able to do that easily and comfortably. The key is you are doing this hypnosis for you. It's all really self-hypnosis. We cannot make you do anything. So you must want to, and you must follow the instructions, and if you'll do that, the chances of your success are pretty high.
Have you ever had a client come in that got stuck in hypnosis and you couldn't get them out?
Absolutely not. It's another myth. No one gets stuck in hypnosis. I will tell you, though, that I have a very cute, what I think of as cute way. Sometimes people will be in hypnosis and they are so comfortable and so relaxed that they just don't want to come out of hypnosis. That's the first thing. So they will sort of stay there. So I will offer them a second opportunity to come out of hypnosis by tapping them gently on the top of their hand. And I will count from 1 to 3 or 1 to 5 or whatever, and invite them to emerge from their hypnotic state, feeling absolutely comfortable and well in mind, body, and spirit. And at the conclusion of that, if they choose at that point not to emerge from the hypnosis, then comes the piece de resistance. I tell them that if they don't emerge from hypnosis on the count of 3, I will never hypnotize them again. And you know what? They always do. Because they like it so much, they always want me to re-hypnotize them.
I refer to those folks as hypnotic junkies. They
Exactly.
love it.
Exactly.
There's a client that came to me, and I gave him an answer, of course, but I'd like to see what your response is. I already know what it will be, but they're saying, you know, I heard that if you hypnotize me, you're going to control me. Do you have a remote control here, and I'm going to be like a zombie? Could you comment on that?
Sure, happy to comment on it. As I think alluded to earlier, all hypnosis is really self-hypnosis. What the client does, they really do to and for themselves. The most any hypnotist can really do is to provide them, hopefully, with the right suggestions couched in the right language so that they make the changes that they need and want to make themselves. Cannot make anyone do anything. I cannot make anybody violate their own moral code of conduct, nor would I ask them to. Nor would anyone who has been properly trained and is doing this professionally ever ask anyone to violate their own moral code of conduct?
And the moral code of conduct is something like if an individual was going to go into hypnosis, and I gave them the suggestion to go down to their local store and steal something, bring it back, or some money, and we'll split it, they would immediately emerge from hypnosis if they wouldn't do that. Now, if they would take that suggestion and they were an immoral person, they would do it. So I think that's something that we might also say that the American Medical Association has put their stamp of approval in 1956, 55.
I mean, maybe even as late as, much later than that, maybe 1958. But the American Psychiatric Association, I think even
And the
1957, and the British
Yeah.
British Psychiatric Association as well.
So they know the value of
They
hypnosis.
understand that it is and have indicated that it is a viable treatment modality. And therefore, we do get nice referrals from physicians and from
Absolutely.
dentists and from psychologists to assist in a complementary way their treatment modalities, which is what we have been trained to do.
And again, my name is Michael Schmidt. I'm a board-certified hypnotist, and my number is 281-787-8999. And we're located in Spring, Texas, basically in the Woodlands. And this is?
I'm Michael Schuman. I'm also a board-certified hypnotist. My office is in the southwest area of Houston, just inside the Loop in Bel Air. You can reach me at 713-662-8511, and we'll be happy to consult with you for whatever your choice.